Walking is often treated as the perfect exercise. It's simple, low impact, and easy to recommend, so doctors, fitness trackers, and public health guidelines use it as a default. For many people, it's a helpful first step toward being more active. But research shows that walking is not the most effective exercise for long-term health. While it has value, it does relatively little to build strength, preserve muscle and bone, significantly improve cardiovascular fitness, or increase overall resilience. Humans evolved to walk for survival, not to counteract modern lifestyles, prolonged sitting, or age-related loss of muscle and bone. Exercise science focuses on outcomes, how well an activity strengthens the heart, muscles, bones, and joints. By these measures, walking is adequate, but far from optimal. Most people walk at an intensity too low to meaningfully challenge the heart or muscles, and the repetitive nature of walking places the same stress on the same joints thousands of times. Over time, this can contribute to knee, hip, foot, or lower back pain. Walking isn't bad, it's just limited. Understanding those limits opens the door to safer and more effective alternatives that deliver greater benefits with equal or better safety when done properly. Now, we can discuss what works better from medical science. Number 1. Interval training. Among the most proven methods of alternative exercise to walking is interval training for cardiovascular exercise. Exercises like squats, mountain climbers, or high knees raise the heart rate quickly and can be done anywhere without equipment. These types of activities entail a series of higher intensity intervals interspersed throughout intervals of rest or very low activity. This method of exercise has come to be known as high-intensity interval training, but it should be understood that high intensity is relative to different individuals. What is significant is relative challenge, not absolute intensity. Interval training is a better stimulus for cardiovascular adaptation since it forces your heart and lungs to work harder in shorter bursts of activity. Improved oxygenation, muscle strength in your heart, and increased blood vessel performance all result from this kind of activity. It has been consistently proven that smaller bursts of harder activity cause a greater boost in your overall cardiovascular fitness than walking. For a safe exercise routine, interval training is beneficial. Since the sessions are of short duration, the combined repetitive stress is less. As rest intervals are incorporated, management of fatigue is ensured. As intensity is proportional to the individual and can thus be modified, everyone can adapt to this form of exercise. In rehabilitation, interval training is often incorporated to strengthen the cardiovascular system. Number 2. Strength training. Another significant alternative for walking as a means of exercise would be strength training. This is perhaps the most critical type of exercise for maintaining good health, coupled with a profound lack of understanding in relation to it. Exercises like push-ups, squats, planks, and glute bridges build strength using only body weight, making them very convenient. Strength training does not imply that one is supposed to lift massive weights to exhaustion. It simply means that resistance is applied to muscles such that they undergo adaptation. This may be done through one's own weight, resistance cords, machines, and even weightlifting. The results of strength training are enhanced muscle strength, joint stability, and higher bone density. Walking does not activate muscles much. It does not prevent a loss of muscle mass as people age. According to the latest research in medicine, Loss of muscle mass, also known as sarcopenia, is one of the most reliable predictors of frailty, falling, and the loss of autonomy. Weight training opposes sarcopenia. From a joint health view, stronger muscles are beneficial because they reduce the stress of joints by shock absorption. It is for this reason that people are advised to make strength training exercises part of their therapy when they have knee pain, hip pain, and or back pain, since walking does not offer the same benefit. Strength training can also enhance balance and coordination. This is because strength training exercises the nervous system. Many people fall without being physically weak, but just because their muscles and nervous system react too slowly to enable them to respond appropriately. Notably, strength training can be done safely across a person's lifetime when done correctly. In fact, various medical bodies endorse strength training for children, adults, and older people. This is due to a low risk of injury when done with proper form and gradual resistance. In reality, individuals who regularly strength train experience fewer injuries when engaging in day-to-day activities due to enhanced resilience. Number 3. Cycling. Cycling is another exercise often found by medical science to be safer and more effective than walking. During cycling, there is cardiovascular exertion along with minimal impact stress. Weight is supported, and movements of the joints can be controlled while exercising. Intensity is also measured accurately. Cycling is better than walking for people who have conditions like arthritic knees, hip problems, or are overweight. Cycling is beneficial for strengthening the muscles surrounding the knees without putting too much pressure on the area. Heart rate can be maintained at a heightened state, which is better than walking at a comfortable pace. An easy alternative is using a stationary bike, which allows indoor workouts regardless of weather. Another option is indoor spin-style cycling, which uses structured intervals to improve endurance and cardiovascular fitness. Number 4. Rowing. A very effective alternative activity for building strength is rowing. Rowing is an exercise that engages most of the main muscle groups of the body and is an excellent cardiovascular exercise as well. Resistance band rowing movements target the same muscles with much less strain. Another is dumbbell rowing exercises, like bent-over rows, which build upper body strength in a controlled way. In terms of healthcare, the benefit of rowing is its ability to distribute the weight exerted on the legs, hips, torso, back, and arms. This action discourages the development of pressure points and also strengthens the muscles. It also promotes proper posture. Rowing machines have been extensively employed for rehabilitation and medical exercise classes because they provide the functionality for orderly movement with reduced stress on the joints. Effective execution is necessary for this activity, and when mastered, this move is arguably the best way for achieving high levels of cardiovascular fitness. Number 5. Swimming. Swimming is one of the most recommended activities when it comes to exercising one's entire body, and this is for several reasons. Water acts as a supportive medium that reduces stress on joints and the spine. On the other hand, water resistance also works on the muscles and cardiovascular system. It is known to enhance respiratory ability, cardiac function, muscle strength, and flexibility. It is commonly recommended for people affected by arthritis, chronic pain, obesity, and nervous disorders. Unlike walking, swimming permits maximum exertion without impact. In terms of safety considerations, swimming is highly useful for individuals with conditions that render them intolerant to any kind of weighted activity. The activity can aid in physical conditioning without worsening any conditions associated with either joints or the spine. Number 6. Nordic walking. Another scientifically proven alternative for losing weight is Nordic walking, where poles must be used for walking. Although it seems to be just another form of walking, it is very different. The inclusion of the use of poles helps activate all of the body muscles and also helps reduce stress on the joints of the legs and other body portions. According to research, Nordic walking increases heart rate and calories burned more than walking, done at a similar rate of speed. It further enhances balance coordination. For those people interested in walking, but wishing for more exercise with less stress on joints, Nordic walking can be a valuable improvement. Hiking or walking with trekking poles engages the upper body similarly to Nordic walking. Number 7. Jump rope. Jump rope is another exercise that is also said to be very efficient. Nonetheless, it should be done carefully. Jump rope exercise enhances cardiovascular fitness, coordination, and strong bones. It is a calorie burner. Nevertheless, rope jumping will not be suitable for everyone. People having joint abnormalities, balance problems, or past injuries in their lower limbs should be cautious. Modification of rope jumping, i.e., low hops, could also prove beneficial. The point is not that one exercise is necessarily best and that all others pale by comparison, but that exercises on their own, like walking, are not sufficient. A human body is best stimulated by diverse patterns. Various patterns stimulate different systems. A safer alternative is shadowboxing, which raises heart rate and improves coordination without repeated jumping. Another option is marching or running in place with arm movements, which mimics the rhythm of jump rope with less impact. The third alternative is low-impact agility drills, such as side steps or quick foot taps, which improve cardiovascular fitness and coordination. Exercise safety can be a misconceived notion. Many people feel that low intensity means being safe, while higher intensity levels mean danger. This straightforward thinking contradicts medical science. Instead, risk factors for injury are much better correlated with poor exercise techniques, over repetition, fatigue, and failure to progress than with intensity. Even walking, which is of low intensity, has the possibility of causing injuries by overuse. Exercises of high intensity, when adjusted properly and executed correctly, help decrease the chances of injuries by strengthening the muscles. Another aspect that can be considered is that of time efficiency. This is because many people walk for extended periods of time because of low stimulation. This leads to increased cumulative joint loads and time. This is because other exercises can allow for equal or more stimulation in lesser periods of time. An exercise program that involves several components is much more effective. These components may ideally consist of cardiovascular training, strength training, balance training, mobility exercises, and recovery training. Walking can be incorporated, but it cannot be the only source of exercise. Another important consideration in all this is the age factor. When young adults only exercise their ability to walk, they are missing an important period for maximizing their bone mass, muscle mass, and cardiovascular fitness. Resistance training and higher intensity exercise for improving cardiovascular fitness are necessary during this period. For people in middle age, muscle maintenance becomes progressively more crucial. Metabolic function, joint health, and injury protection require muscle strength and cardiovascular function. Simple walking will not reverse the process of aging. In seniors, safety considerations may come first. However, challenge is still necessary. Resistance training activities, balance drills, cycling, swimming, and interval training cardio exercises have all been proven beneficial in increasing autonomy and falling safety and overall quality of life. Simple walking does not fulfill this purpose. From medical science comes the repeated demonstration that properly prescribed exercise is safe and valuable into old age. Avoiding challenge leads to regression. Intelligent challenge maintains function. Now, I will cover some of the common misconceptions that have been perpetuated on the topic. The first myth is that walking alone is an effective exercise because it burns calories. Burning calories is one thing. Overall health is made up of many other factors, such as muscle mass, insulin sensitivity, cardiovascular efficiency, and joint function. A common misunderstanding is that strength training is something that only athletes should do. In reality, strength training is one of the best ways to prevent many diseases. Another myth was the perception that low-impact activities offer little benefit. Swimming, cycling, and rowing are high-intensity activities when done at suitable levels of intensity. Finally, there's the more of the same will be better. This basically means that if you are doing an exercise, doing it more will be a great improvement. This is a poor philosophy, especially when a variety of workouts will be helpful. This philosophy, in all these activities, walking occupies an interesting position. Walking has many benefits. In terms of fitness, it's a great way to take a recovery day, relieve stress, and maintain a consistent level of activity. Sometimes walking can be a key component in leading a more active lifestyle. But walking should not be the entire plan. Medical science does not advocate walking as a universal remedy to keep health in check. Medical science promotes movement that actively challenges the body in several ways while bearing in mind limitations. If it is longevity, power, motor function, and autonomy which are the objectives, then rather than simply walking more, it is moving wisely, which is the most safe and effective course. It means incorporating exercises that will help build muscle, increase heart rate significantly, safeguard joint conditions, and exercise balancing and coordination. It means exercising activities that will help strengthen the body rather than gradually deteriorate it. The good news is that these alternatives are available. They do not involve so much hard work or athleticism. There is intention, progress, and also reverence for the body. The body will adapt itself to the tasks for which it is used. If the tasks are only walking, the body will excel at walking, but little else. If the tasks include lifting, cycling, swimming, rowing, and dynamic movement, the body will be stronger, more resistant, and better protected against injury and disease. This is not a question of opinion, but rather the result of medical and exercise science investigation over many years. The most secure exercise is not necessarily the most comfortable one today. The most secure one is the one that keeps you able, independent, and strong tomorrow. At this point, the message is not that we need to exercise harder, faster, or longer. The message is simpler and more hopeful. The goal is not athletic performance. The goal is continued independence. Medical science shows something important. The body does not fail because it is challenged. It fails because it is no longer challenged at all. Strength, balance, and cardiovascular capacity fade quietly when they are not asked for, but they return when gently and intelligently reintroduced. This is especially important for seniors. Aging does not mean avoiding effort. It means choosing the right kind of effort, applied carefully and progressively. Even small amounts of well-chosen challenge send a powerful signal to the body. Stay capable, stay resilient, stay independent. Here's the key. It's not about intensity, it's about consistency. It's not about perfection, it's about participation. And it's not about fear of injury, it's about confidence through gradual progress. Here's a safe and realistic weekly plan for seniors. 3 days, strength and balance, 20 to 30 minutes. Chair squats or sit to stands. Wall or countertop push-ups. Resistance band rows. Standing balance drills. 2 days, cardiovascular challenge, 15 to 25 minutes. Stationary cycling. Swimming or water walking. Light interval training, alternate easy and slightly harder effort. Most days, light movement and recovery. Walking for relaxation. Gentle stretching or mobility work. Easy movement to maintain circulation and reduce stiffness. Think of exercise not as something you do, but as something you maintain, like eyesight, balance, or memory. Every session is an investment in standing up more easily, climbing stairs with confidence, carrying groceries without strain, reducing risk of falls, preserving independence for years to come. Progress should be slow and measured. If something feels too easy, adjust it. If it feels uncomfortable, modify it. There is no rush, only direction. Walking will always have a place, but it should not be the entire plan. The safest exercise is not the one that feels easiest today. It is the one that keeps you capable tomorrow. By moving with purpose, variety, and modest challenge, the body remembers how to function well. Strength returns. Balance improves. Confidence grows. Aging does not require withdrawal from effort. It requires intelligent engagement. And when movement is chosen wisely, the body responds at any age. Move wisely. Stay strong. Stay independent.